All right, going to scan the room. I'm going to be in the great room. I think that's getting everything, the walls, the ceilings. I think that's getting things. All right. Got to plug the laptop back in so that it doesn't run out of power. All right, plug back in. Make sure that it's centered appropriately. There we go. All right. My name is Rex Gaines. I am a student at the University of Memphis, Loewenberg College of Nursing in the FNP program. Today I'll be performing a head-to-toe assessment on my patient, Mr. Williams. Today is October the 26th. It is 6 p.m. on a Saturday, and it is fall 2023. I'm going to start by assessing the skin of the head, face, neck, posterior chest, anterior chest, and abdomen. I'm assessing for color, temperature, moisture, texture, edema, turgor, lesions, nevi, bruising, and scars. I am going to then assess the head for shape, size, and symmetry, midline position. Then I'm going to palpate the temporal arteries for tenderness, followed by palpating the lymph nodes of the face, head, and neck. I'm going to start with the submental, submandibular, tonsillar, parotid, postauricular, preauricular, the occipital, which is at the base of the head and top of the neck, anterior cervical, posterior cervical, and the supraclavicular for tenderness, nodules, masses, hardness. All right, next I'm going to be palpating the temporomandibular joint, the TMJ, for subluxation, crepitus, and tenderness. Next, I will be assessing cranial nerve number 5, the trigeminal. If you would, I would like you to clench your jaw for me, and I'm feeling the masseter muscle bulge. That is for function. Now, sensory, I want you to close your eyes. Tell me where you feel it.
Forehead, chin, left cheek, right cheek, neck.
All right. Cranial nerve number 5 trigeminal is intact. Next, I'll be assessing for cranial nerve number 7, the facial nerve. I want you to raise your eyebrows, smile real big, frown real big, puff out your cheeks. Now, puck your lips. Cranial nerve 7 is intact. All right, next I will be assessing the ears. I'm looking to see their shape and position. I'm going to palpate the pinnae and the tragus for tenderness. Next, I'm going to be taking the otoscope, and I'm going to be inspecting the auditory canals for color, lesions, and drainage. Tympanic membrane is pearly gray. Next, I will be performing hearing tests. There will be 3. If you would cover your right ear for me, I'm going to do the whisper test. Repeat after me.
1, 2, 3.
Other ear.
A, B, C.
Excellent. Now I'm going to do the Weber's test. I want you to tell me if you hear this in both or one ear.
I hear them both.
All right. Now I want you to tell me which is louder, 1 or 2. 1 or 2.
2.
All right. 1 or 2.
2.
All right. That is the Rene test. Air conductivity is greater than bone conductivity. Next, I'm going to be going to the eyes. I'm going to be assessing the lashes, brow, and any palpable fissures. Next, I'm going to be assessing the sclera and conjunctiva in the right and the left eye for color, drainage, lesions. All right, next I'm going to be assessing cranial nerve number 3, the optic nerve, for gross visual acuity, both direct and peripheral. All right, while occluding one eye, I'm going to hold the Snellen chart about 6 feet away. I want you to read the smallest line you can.
EPTZO.
Now occlude the other eye. Tell me the smallest you can read.
CLCF.
All right. Now, while keeping, occlude your right eye again. Tell me when you can see my finger.
I see it.
All right, occlude the other eye. Tell me when you can see my finger.
I see it.
All right, peripheral vision and visual is intact, or optic nerve number 3. Now I'm going to be assessing optic nerve number 4, the oculomotor. All right, I want you, number 4, oculomotor. All right, I want you to, we're going to come back to that. I'm going to take the ophthalmoscope and I'm going to assess for red reflex. Can you take glasses off?
Absolutely.
All right, red reflex and other internal structures of the eye. All right, I'm going to be assessing cranial nerve number 4, the oculomotor, for direct and consensual pupillary response to light. I'm going to be assessing the right first, the left first, the right while looking at the left while looking at the right. Both pupils are equal, round, and reactive to light. Cranial nerve number 3, the oculomotor, is intact. Next, I will be assessing cranial nerves 3, 4, and 6, the oculomotor, the trochlear, and the abducens nerves in the 6 ranges of motion. I want you to look at my finger and without moving your head, follow my finger in the 6 cardinal directions. All right, those cranial nerves are intact. Next, I will be assessing for accommodation and convergence. I want you to look at that light switch against the wall right there. Now I want you to look at my finger. Keep looking at it. Keep looking at it. All right. Next, we're going to be going to the nose. You can put your glasses back on if you'd like. All right, I'm checking to see that it's straight and midline. Now, if you would occlude your right nostril, I want you to sniff big with your left. Now, exclude the left, sniff. Both nares are patent, checking for nasal patency. Now, I want you to close your eyes. I'm checking cranial nerve number 1, the olfactory. I want you to take a sniff and tell me what smell you smell.
Cinnamon.
That is correct, cinnamon. All right, you can open your eyes again. Now I'm going to be palpating the frontal sinuses. Actually, they're more in here. And under the cheekbones for the maxillary sinuses for any tenderness. Next, we're going to be going to the mouth. I want you to open your mouth for me. And I'm going to be assessing for the lips, gums, teeth, tongue, floor of the mouth, underneath the tongue, the top of the mouth or the palate, the buccal mucosa, the salivary glands, the posterior pharynx, and you do have your tonsils, and they are grade 2. All right. Those are all present. All right. And I am checking them for color and lesions. All right. If you'd open your mouth real quick, I want you to say ah.
Ah.
All right. I am checking central nerves 9 and 10, for which are the glossopharyngeal and vagus nerves. The uvula and soft palate rise symmetrically with phonation. Those nerves are intact. As well, we're going to check for cranial nerve number 12, the hypoglossal nerve. I want you to stick your tongue out, try to touch your nose, touch your chin, move it to the left, move it to the right. Tongue is midline without fasciculations. Cranial nerve 12 is intact. Now we're going to move to the neck. I'm going to palpate the tragus for being straight midline. Now I'm going to be assessing the thyroid gland. I'm going to be pushing to the left and feeling with the right. I want you to swallow. Now I'm going to be pushing to the right, feeling with the left if you'd swallow again. All right. Next for the throat, I'm going to be unilaterally palpating the carotid arteries, checking the right, followed by the left. They're +2. I detect no thrills, and I'm going to be auscultating them as well with the bell for bruits on the right, on the left. I do not detect bruits. All right, Mr. Williams, if you would, can I have you turn around for me? We're going to be checking your respiratory system. All right, I'm immediately going to check for obvious signs and symptoms of respiratory distress, retractions, nasal flaring, cyanosis, tachypnea, tripod position, use of accessory muscles. Then I'm going to look for obvious deformities and symmetry. I'm going to check for symmetrical chest expansion. If you would inhale for me. Now exhale. All right. Now I'm going to percuss in the intercostal spaces, starting at the top of the scapula. The posterior lobes, including the right middle lobe. I detected resonance throughout. Next, I'm going to be auscultating. I want you to just breathe normally. All right, now I'm going to check for egophony. Every time I touch you with the diaphragm, I want you to say, not E, I want you to say 99, all right?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, now I'm going to check for bronchophony. I want you to say E.
E, 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 E.
All right, now I'm checking for whisper pectoriloquy. I want you to say 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
All right, now I'm going to check for tactile firmness. Every time I touch you, I want you to say 99.
99, 99, 99, 99, 99.
All right, if you would, I'd like you to spin around now. Again, I'm going and have a seat. I'm going to check in the anterior chest, that was posterior chest, for obvious signs of deformity and symmetry. Now from the front, I'm going to have you inhale, exhale. All right, chest expansion symmetrical, and I'm going to listen to the front. And I cannot hear the posterior right middle lobe from here, so I did not check for it. Next, I'm going to do tactile firmness from the front, say 99.
99, 99, 99, 99, 99.
All right. Now I'm going to check the heart. All right. I'm going to first check the aortic valve, which is at the second intercostal space, right side sternal border, followed by the pulmonic valve, which is the second intercostal space, left side sternal border, Erb's point, which is the third intercostal space, left side sternal border, the tricuspid valve, which is the fourth intercostal space, left side sternal border, and the mitral valve, which is left side, fifth intercostal space, midclavicular line. Next, I'm going to be doing them with the bell, checking for bruits, so aortic, pulmonic, Erb's point, tricuspid, mitral. I'm also going to palpate for the PMI, the point of maximal impact, where I can feel the heartbeat the most. I will also be, on this side, I'm going to be listening to the apical pulse for a whole 60 seconds. 60 seconds has elapsed. The rate was 66 beats per minute. The rhythm was normal sinus rhythm. All right. Now, Mr. Williams, if you would, can I have you lay on the table with the head of the bed at about 30 to 45 degree angle. I'm going to immediately check for retractions, heaves and lifts, jugular venous distension, JVD. I'm also going to palpate those same points for any thrills. So we're going to do the aortic, pulmonic, Erb's point, tricuspid, mitral. I am also going to listen to them with the bell for any bruise while he's laying down. Aortic, pulmonic, Erb's point, tricuspid, mitral. All right. Now I'm going to be checking the abdomen. I am initially looking for contour and symmetry. Next, I will be auscultating the four quadrants, starting with the right lower and the diaphragm. then the right upper quadrant, the left upper quadrant, the left lower quadrant. I listened to each for a full minute. They were normal active vowel sounds. Next, I will be percussing it for tympany, flatness, and dullness in each of the quadrants. I detected dullness over organ areas, and I detected tympany over the rest of the vowel. Next, I will be palpating for tenderness and masses, starting with light palpation, going to deep, light palpation, going to deep, light palpation, going to deep, light palpation, going to deep. All right, next I will be palpating for the liver and spleen. I'm going to go right up under the rib cage. I want you to exhale as much as possible. Go on there. Now inhale as much as possible. I can feel the liver border. It is not enlarged. All right, now I'm going to feel for the spleen. I'm going to do this awkwardly so the camera can see me. I'm going to reach back underneath the rib cage and scapula and push in, and do the same thing. Push in with this hand. I want you to exhale right under the rib cage. Inhale for me. I could not feel the spleen, which is good. All right, now I'm going to be auscultating with the bell for bruits, the aorta, the left renal artery, right renal artery, left iliac artery, right iliac artery, left femoral artery, right femoral artery. Detected no thrills. All right, Mr. Williams, if you would, can I have you sit up and face that way for me, please? Face that way, if you would. I'm going to be checking for costrovertebral angle tenderness, CVA. I'm going to put my hand here. I'm going to hit it. Now over the other kidney. Let me do it this way so the camera can see. All right, no tenderness. If you would, I'd like you to have a seat back in that chair for me. All right. So next we're going to go to the musculoskeletal system. I am going to be immediately looking at the lower extremities and upper extremities, assessing overall color, warmth, and skin integrity, and signs of edema. Next, I'm going to be palpating the feet, the ankles, the knees, the hips, hands, wrists, elbows, and shoulders. I'm palpating them for redness, swelling, deformity, symmetry, nodules, tenderness, and crepitus. Next, I will be assessing the strength. I want you to lift up your feet for me, plant dorsiflex. Now push your feet down for me. All right, now kick your legs out, both of them. All right, pull your legs in, push your knees out. There we go. Knees in. I want you to grab my hands and squeeze them. All right. Keep me from pushing down. Keep me from pulling up. Push your elbows out. Push your elbows in. Strength is 5 out of 5 on the feet, knees, hips, hands, elbows, or biceps and triceps, and the shoulder girdle. Next, we're going to be going through range of motion. I'm going to start with the hands. I want you to take your fingers. I want you to flex them, extend them, hyperextend them, abduct them, adduct them, thumb opposition. Now, if you'd stand up for me, I want you to take your arms, elbows, I want you to flex them, extend them, hyperextend them. Now, the shoulder girdle, I want you to flex them, extend them, hyperextend them. Now, I want you to abduct them, adduct, cross over. All right, and I want you to circumduct them. The wrist, I want you to flex, extend, hyperextend. I want you to ulnar deviate, radial deviate, ulnar deviate, rotate. All right, now let me have you seated real quick. I want you to take your toes, just like the fingers. I want you to flex them. We try doing both at the same time so the camera can see it a little bit better. All right, I want you to flex them, extend them, hyperextend them, your toes, and as best you can, abduct them, spread them apart, adduct them, bring them together. All right, now for your ankles, I want you to plantar flex, dorsiflex, now invert, evert, rotate them, do it with the other foot as well, plantar flex, dorsiflex, invert, evert, rotate. Now if you'd stand up for me, we're going to start with the right leg. I want you to let's start with the knee. I'm going to say it like this. I want you to flex, extend, hyperextend. Now the left leg, flex, extend, hyperextend. Now the hip for the right, I want you to flex, extend, hyperextend. Now I want you to abduct it, adduct crossover. Now circumduct it. Also want you to internally rotate and externally rotate. All right, left leg, I want you to flex the hip, extend, hyperextend, abduct, adduct crossover. I want you to internally rotate, externally rotate, and circumduct. All right, so we did range of motion for the toes, ankles, knees, hips, fingers, wrists, elbows, and shoulders. We assessed for strength. Next, if I can see actually have a seat one more time, good sir. I'm going to assess the radial pulses bilaterally, the dorsalis pedis pulses bilaterally, the tibialis posterior pulses bilaterally. All were +2, no thrills. All right, I'm going to have you, let me see your thumbs real quick. Capillary refills, index finger, capillary refill, big toe, capillary refill, all with less than 3 seconds. I'm going to do deep tendon reflexes. All right, we're going to start with the right arm. We're going to do brachioradialis, left arm, brachioradialis, biceps. Sorry, this chair's kind of big. All right, now we're going to go back to the right triceps. Relax. Okay, left triceps, right patellar, left patellar, right Achilles, left Achilles. All right, deep tendon reflexes are present. If I could see your foot real quick, we're going to do Babinski. All right, left foot, Babinski. Excellent. Now, good sir, if I could have you stand up and turn around for me. So I'm assessing the spine for any expected curvatures. Actually, I did not realize I had that canted down. I'm going to assess the spine for expected curvatures like lordosis in the cervical and lumbar spine. I'm also going to palpate it for straightness and tenderness. If you would, I want you to flex forward like you're trying to touch your toes. I'm going to check for expected or obvious scoliosis. Now, if you would, in that position, you just flexed your lumbar spine. I want you to stand up straight, which is extension, hyperextension. I want you to laterally bend to the right, laterally bend to the left. I want you to rotate to the right, rotate to the left. Now, using your cervical spine, your neck, I want you to look down to the floor, which is flexion. I want you to look straight ahead, extension. Look up at the ceiling, which is hyperextension. I want you to laterally bend to the right ear to shoulder, left ear to shoulder. Now rotate just your neck, look to the right, look to the left. All right, range of motion for neck and cervical and lumbar spine. Also, while you're standing there, I'm going to ask you to shrug against me. All right, we're checking for cranial nerve number 9, which is the spinal accessory nerve. It is functional, intact. All right, Mr. Williams, if you would, can I get you to walk across the floor like normal toward the camera? Now, if you would turn around and walk heel to toe in tandem, checking your balance. A couple more steps. Okay, that's good. Thank you, sir. All right, now we're going to do the Loewenberg test. So I'm going to have you put your feet as close together as possible. I want you to act like a mummy. I'm going to have you stand like that and try not to move and sway while protecting you. And 30 seconds has elapsed. Now I want you to do the same thing you're doing except close your eyes. I'm assessing for swaying and movement. 30 seconds has elapsed. I have not detected it. Loewenberg test is good. Next I'm going to have you, because I don't think that you're going to be a danger, I want you to take your right foot and I want you to hop on it 3 times. Excellent. Now if you would do the same on your left foot. All right, you can, let's see. Oh, real quick, have a seat, good sir. I'm going to check for gravesthesia and stereognosis. Would you close your eyes for me? Well. All right, good sir. I want you to tell me what's in your right hand,
A pen.
left hand.
A cotton.
All right, now I want you to tell me with your eyes closed what letter I'm signing on your right hand,
A.
left hand.
B.
All right, real quick, I'm going to assess your cerebellar coordination with quick hand movements. We're going to do serial finger movement. Good. Now do hand flip-flops. All right. That concludes the head-to-toe assessment.